Hello and welcome to this short webinar on California Medicaid physical therapy coverage. My name is Zachary Edgar, and my company is called Therapy Comply. Therapy Comply is a membership-based compliance firm dedicated to assisting physical, occupational, and speech therapy practices and facilities. Members can access a wide selection of guides, sample policies, and forms on Medicare, Medicaid, HIPAA, TRICARE, and state rules and regulations that apply to therapy practices. Members can also email me at any time with any compliance or billing questions or schedule a phone call. Please visit the website at therapycomply.com for more information. This presentation is for informational purposes only. None of the material is intended as legal advice. Statutes and regulations are all subject to change. This presentation describes the California Medicaid fee-for-service coverage of physical therapy. Medicaid managed care plans must offer the same amount of care as the state, but can change prior authorization, personnel, and documentation deadlines. MCOs do follow state rules in many cases, but therapists should always double-check with payer policies. On the website, we have more detailed information on the coverage of Medicaid's coverage of outpatient therapy services, fee schedules and code lists, billing for non-covered services, information on qualified Medicare beneficiaries, information on MCO plans, coverage and prior authorization, and members can always request information or ask questions about Medicaid coverage and compliance. The physical therapist must be licensed as an RPT by the California Board of Medical Quality Assurance or similarly registered or licensed by a comparable agency in the state in which the therapist practices, and shall be a graduate of a program in physical therapy approved by the agency or organization recognized by the Council on Post-Secondary Accreditation or the U.S. Department of Education or its equivalent. The manual and regulations do not address assistants, aides, or students. The written prescription of a physician, dentist, or podiatrist is required for physical therapy services. The following must be present on the prescription form: the signature of the prescribing practitioner, the name, address, and telephone number of the prescribing practitioner, the date of the prescription, the medical condition necessitating the services, the diagnosis. Supplemental summary of the medical condition or functional limitations must be attached to the prescription. Specific services prescribed, frequency of services, duration of medical necessity of services, specific dates and length of treatment should be identified if possible. Duration of therapy should be set by the prescriber. However, prescriptions are limited to 6 months. Anticipated medical outcome as a result of therapy, therapeutic goals, and the date of progress review when applicable. Prescriptions must be specific as possible regarding procedures, modalities, and services. For example, physical therapy alone is not sufficient notation on the prescription. A specified duration and frequency of therapy must be indicated in weeks or months, and the purpose of therapy should be the return of adequate function, not necessary restoration of full capacity. Physical therapy services shall include physical therapy evaluation, treatment planning, treatment, instruction, or consultative services, and application of topical medications. Services are limited to treatment immediately necessary to prevent or to reduce anticipated hospitalization or to continue a necessary plan of treatment after discharge from the hospital. Services do not include the use of roentgen rays or radioactive materials or the use of electricity for surgical purposes, including cauterization. A modality is any physical therapy treatment, unless listed separately, that does not require the continuous attention of the therapist, such as hot or cold packs, traction, mechanical, electrical stimulation, vest-pneumonic devices, paraffin bath, microwave, whirlpool, diathermy, infrared, ultraviolet, and ultrasound. A procedure is any physical therapy treatment, unless listed separately, that requires the continuous attention of the therapist, such as therapeutic exercise, neuromuscular reeducation, rehabilitation services, functional activities, gait training, orthotics training, prosthetics training, electrical stimulation, iontophoresis, manual traction, massage, and contrast baths. All physical therapy services, including initial and 6-month evaluations, require authorization. The authorization request shall include the diagnosis, modalities, frequency, therapeutic goals, duration of treatment, and data progress review where applicable. The physician, dentist, or podiatrist prescription shall be attached to the authorization request. Prior authorization shall not be granted for more than 30 treatments at any one time. Authorization shall be valid up to 120 days. Authorization for physical therapy services shall be contingent upon compliance with the following requirements. There is a direct and specific relationship of the services to a written treatment plan prescribed by the physician, dentist, or podiatrist after consultation with a qualified PT. The complexity and sophistication of the level of service or condition of the beneficiary requires the judgment, knowledge, and skills of a physical therapist. The provision of services is with the expectation that the beneficiary will improve significantly in a reasonable and generally predictable period of time, or to establish an effective maintenance program in connection with a specific disease state. Services to be performed by a qualified PT who meets the standards. The service is considered under accepted standards of medical practice to be specific and effective treatment for the beneficiary's condition, and the service is reasonable and medically necessary for the treatment of the beneficiary's condition. Thank you for watching, and please visit the website for a lot more comprehensive information on physical, occupational, and speech therapy compliance and billing. Please like and subscribe. We'll be adding many more soon.